Everyone is different. This needs to be done on an individualized basis because everybody has different levels and imbalances. We do this by evaluating oxidative stress, metabolic syndrome and metabolic impairment analysis. Hormonal chemical imbalances, evaluation of the exposure to toxins, and measuring different markers by breath analysis, urine, saliva, blood, and body fluids are examples of tests that should be done. None of these tests are done on routine basis if ever. To keep up with new medical developments, follow www.viratech.org and www.Cancer.im for new health solutions as they become available. By finding solutions of the underlying problems for cancer, this can also help with other autoimmune and degenerative diseases such as diabetes, heart disease, kidney disease, and other problems. By finding people that have metabolic impairment syndrome, oxidative stress with different kinds of tests, we can find out the specific abnormalities in and around the cells to be able to treat them. This serves as a diagnostic pathway for screening for disease and as part of an algorithm to find if we have a precancerous condition or if it's already converted to cancer. This same situation for diabetes is the prediabetes or has diabetes already occurred? I discuss the metabolic state of health, or metabolic impairment because of the strong connection metabolic syndrome has to causing many kinds of cancers. We believe this is due to the accumulation of acetoacetic acid, hydroxybutyric acid, and other acids and ketone bodies which lead to acidosis. By correcting acidosis in and around the cell, we can not only help the metabolic state, we can improve outcome for cancer and possibly prevent or delay cancer. By measuring VOCs, that are volatile organic compounds, by breath analysis, we can ascertain if there's compounds that are in combination as a result of a specific cancer. There are 3,481 known VOCs in the breath, and this helps us to analyze what's going on in the body with hundreds of inexpensive tests. We can also do air analysis of urine and body fluids for health screening. For more on this subject, see my book called Breath Analysis. What's evolving for a new age of medicine is inexpensive tests that are not otherwise available, and can be done with frequency and in forms of panels to find and treat diseases. Breath analysis is a method for non-invasive tests on the clinical state of an individual by monitoring volatile organic compounds present in the exhaled breath of humans and animals. Breath gas concentration can then be related to blood concentrations via calculations, for example in blood alcohol and other kinds of testing. The area of modern breath testing commenced in 1971, when Nobel Prize winner Linus Pauling demonstrated that human breath is a complex gas, with over 200 different volatile organic compounds, and physicians have used breath analysis since the days of the ancient Greek scientists. Now there are some 3,481 compounds in breath exhalation that can be measured. Volatile organic compounds are made inside the body, are released within the human chemical system as a result of certain exposures to chemicals, normal metabolic activity, or due to disease states. They enter the body and are eventually metabolized or excreted via exhalation, skin emission, urine, sweat, tears, or other body fluids or secretions. Healthcare in the US now costs over $2 trillion a year. I believe that on a worldwide basis we are now in a downward trend in our ability to cover healthcare costs. Breath sampling is non-invasive and breath samples can be tested frequently due to low cost. Finding of potential disease biomarkers can be obtained by analysis of exhaled breath.